South Sudan is among the countries most affected by gender-based violence in Africa. In fact, the UN Commission on Human Rights has described cases of abuse against women there as hellish. So a delegation from South Sudan has spent 2 days here in South Africa this week seeking knowledge on how victims and survivors can be supported. Let's unpack this for you now. Let's bring in Shruti Upadhyay, who is a UN Population Fund gender specialist as well as Social Development Department's Malope, both of them joining us via our video link. And to both our guests, it's lovely to have you on the program. Thanks very much indeed for making time. Shruti, I wonder if I can begin with you. I mean, the UN Commission on Human Rights says the situation in South Sudan is hellish for women and children. How would you describe the levels of gender-based violence there?
First of all, I would like to highlight here that gender-based violence is a global phenomenon. It exists across any country that we pick up. Even if we pick up the country that stands first in the Gender Equality Index, that has the rate of gender-based violence. Now, coming to South Sudan, when you, because of the protracted conflict that we have been going through, also the economic challenges that we are facing, and it compounded with the COVID-19, the rates of gender-based violence, as you rightly said, is quite high. This can be seen in terms of a very high maternal mortality ratio as well, which is one of the highest in Africa. We have a very high rate of child marriage, which stands at almost half the girls end up getting married before they turn 18. We have a very high rate of teenage pregnancies that is also linked with the child marriage, and also as we know, teenage pregnancies have a very close link with gender-based violence. So when you look at South Sudan, we do not have any credible data that can look at the scale and prevalence of gender-based violence, but from the work that we do, we know that it stands very high.
Sure. And, you know, you've outlined the social-political context in which that happens, and that's very important because, you know, at the very least, it gives us an idea of how we got here and, you know, how best to come out of this moment. When we talk about the institutions that hold people accountable in South Sudan, how much of those being dilapidated by the civil war, which, to be fair, ended just about, you know, a few years ago in 2018?
So in terms of the institutions of accountabilities, I would say alongside all other institutions, they are also working towards building their strength. We do have challenges with regards to the accountability systems, but so are the institutions that are implementing and that are responsible for looking at the overall well-being of the population. And that is why when we made the visit to South Africa, one of the main objectives was to see how do we support the institutions, the service provision institutions, so that they can also then link with the accountability institutions like South Sudan Human Rights Commission and also the Ministry of Gender, Child and Social Welfare. Linking with the civil society in terms of strengthening the accountability institutions across the country.
Sure.
We have challenges with regards to also, you know, the transport systems, the connectivity to the remote areas, and that also makes it more difficult in terms of monitoring the accountabilities across the country.
Right. So let's bring you into this discussion. I mean, I can imagine many people watching asking themselves, what advice South Africa could possibly be giving to countries like South Sudan in a context where gender-based violence in our country is described as a second pandemic?
Thank you, Ayanda, and I really appreciate the opportunity to have this discussion. I must say that during the visit by South Sudan, there were number of areas we focused on in terms of showcasing what we are doing in South Africa in terms of curbing the scourge of gender-based violence. And you are correct to say we are not immune. We are really considered to be one of the highest in terms of violence against women and children. We focused on 3 areas, in fact more areas, but there was mainly on issues of showcasing the legislations that we have in place, strategies and policies to deal with gender-based violence. And then we looked at also the various interventions that are on the ground in terms of dealing with gender-based violence. For example, in this case, we took a tour with the delegation to one of our facilities, which is a shelter service for victims of gender-based violence. We also took the team to the Gender-Based Violence Command Center, and that was mainly in terms of ensuring that we showcase to them how are we able to reach victims in the most remotest of areas in terms of providing the service via technology. So those were the areas that in the main we focus on. There were other areas, of course, but the legislation, policy strategies, as well as the facilities, and then also the use of technology to reach victims in the most remote of areas. Yes.
What I've always been taken aback by, Sbusiso, is how some experts have described the levels of violence in our country as being, similar to those of countries at war. I wonder, in your interactions with this delegation from South Sudan, whether you reckon South Africa may perhaps also have lessons to take from a country that's coming out of a war.
Yes, of course, there will always be a lesson to take, Ayanda. For example, when we had a discussion with the delegation, we also got to know that, in our case, normally the violence against children, especially young children, as much as it's always there in the media as well. But when we're having a discussion with the delegation, we realized that in their case was even it was appalling of just listening to the cases of children that get violated, especially in terms of rape, and the fact that those children has to be rescued and be placed in shelters and so forth. And one of the lessons then that we or areas that we realized was the fact that we have been to some extent in a better position in a sense that we've got clear currently legislation such as the Children's Act of 2005 that sort of guide the services, and also separating services that you provide to vulnerable groups such as children and services that you provide to adult victims. So there will always definitely be. And then the other aspect that we learn as well is the very strong collaboration between the welfare, if I can put it, or social development type, and health, because a number of these issues of GBV, they also cost a lot of health damage, which then relates to other future health problems if they are not dealt with.
Yeah. Absolutely. Very important issues being discussed, and all the best to both countries, really, given who depends on us getting this right. Let me thank you for both your time. That's Shruti Upadhyay, who is a UN Population Fund gender specialist, also joining us there. Malope, part of the Social Development Department. To both of you, once again, thanks very much indeed.